Hi, welcome to AFT-Maryland's Legislative Roundup. I'm Ray Baker. I'm our Communications Director, and joining me is Denise Riley. Denise, thank you so much for taking time out of your very busy schedule during this session to have this conversation.
Well, thank you for having me.
One of the things, Denise, I want to get started with this part of the session is we're in the middle of the session and we're coming up on something called crossover soon, right? That means that most of our bills need to go from one house to another. We're tracking pretty well with AFT-Maryland, and you guys in our legislative team are really keeping a good eye on all of the bills that we're working on. Now, the bills that I would like us to think about today are really both have support in both the House and the Senate. The first one that comes to mind is House Bill 673, and this is for state healthcare employees. Can you tell us how this will affect the members in our state federation?
Well, I'm very happy to report that that bill has passed both houses. Unlike most bills right now in the legislature, it has passed both houses and is waiting the governor's signature. The nurses in the state hospital systems will be able to choose to work a 36-hour work week, which would be 12-hour shifts 3 days a week. The state loves this. Nurses love this because of the fact that there's a continuity of care. Instead of every 8 hours, the shifts changing, there will be an overlap, and that will be that will help out the hospitals, and nurses can choose that that ability to just work the 3 days a week.
I love the way that this is an example of our members having a say, a democratic say in their workplace. They wanted something, they brought it to our state federation. Our state federation, you guys did the hard work of ensuring that this bill moved through the House and the Senate. Denise, that's a fantastic job. And we'll keep our ears and eyes attuned to Governor Hogan for this signature. Another bill that I know is making its way through is House Bill 73. And this, House Bill 73. And this is about state workers and telework. Now, many workers were teleworking, both those of us in our state federation and beyond, on account of COVID-19. So what updates do you have for us regarding telework and state employees?
Yes, I'm happy again to report that that has passed the House, and the basically right now is at the local level and at the state level. Telework is catch all can, right? That you can work from home, you can't. What's the policies, everything. This will basically establish that each government must establish its own teleworking plan and report that to the state. So you can't say one day, okay, Joan Smith, you come to work today, but next week you can work from home. So it will have not only it required them to establish a plan and policy and guidelines, but report those to the state for accountability.
And that's perfect. And the accountability is what's important, because if any of our state employees, be they members of Impact, MCEA, AFT Healthcare Maryland, or any other of our state employees find that their agency is not in compliance, that reporting to the state for the accountability is where the state federation, AFT Maryland, we can use our connections and leverage our engagement and relationships with our state delegates and state senators to hold those agencies accountable. That is wonderful to hear. Now, on a local level, Denise, we know that HB 85 is a workers' compensation bill that will have a specific and particular impact for our members from the Baltimore County Federation of Public Employees. Tell us about that.
The state readjusted for first responders and correctional officers the ability to eliminate the tier 1 of workers' comp. I don't want to get into all the complicated parts about this, but basically there's a tier 1 and tier 2. The tier 1's gone. So when county correctional officers get hurt, they will bypass tier 1 and go straight to tier 2, which is the difference between it is a 1/3 of the pay to 2/3 of the pay.
And that is going to be significant for both those members in the Baltimore County Federation of Public Employees, those correction officers, and also their families. And so while we hope that all of us can maintain a safe and healthy work environment, God forbid if the worst should happen, it is good to see that the union is stepping up to advocate to ensure that members and their families are getting as many resources as they need. Denise, I know you're super busy. You've got tons of things to do. And although you're not physically in Annapolis, you'll probably log off from this and log back on to something else, doing the work on behalf of our many locals for their members. We thank you so much for taking the time. And we'll check back in with you in a few weeks, because in about a month, if I'm not mistaken, the legislative session will wrap up and we will have an opportunity to have a comprehensive conversation about all that you and your team has done in Annapolis, or virtually in Annapolis, for our members. Denise, thanks so much for all of your updates.
Thank you, Ray.
And if you would like to know what your local is prioritizing in Annapolis, that they're tasking Denise to work on, be sure to get in touch with your local leadership.